Hello, everyone. Well, I specialize in aesthetic surgery. I'm a plastic surgeon. To be honest, I'm a bit strange. Sometimes the patients also get surprised. A patient comes to me for a physical examination. I say, "You're not suitable for this surgery. You don't have it. I mean, we wouldn't get a good result. I don't recommend it." The patient says, "You are the fourth plastic surgeon I visited. The previous three only gave me a price, and you are the only one who said that it wouldn't go well." Well, this could happen. Each surgeon has different indications for surgery. For me, I don't accept patients if it will be not a good result. Sometimes they just come to see me for really nothing necessary. What happens if you operate? I'm absolutely certain the patient won't be happy with the outcome. That's because what she wants doesn't fit her. Do I make myself clear? The patient comes and demands a gluteal augmentation with this volume of a buttock. I say it won't work when it won't work. For me, getting a nice result is much more important than earning money. I want the patient leave here with an impressive outcome. Now, when we say no, patients are surprised. I mean, think about it for a while. Okay, get a few people's opinion, but let me tell you this. The surgeon who says no could be right. Well, think about it too. I mean, there are many patients disappointed after they didn't go with what we recommended. There are few examples of this. I'll talk about those in this video. In one of the instances, a female model came in asking to have a bisektomy. She looks extremely stunning in the photo. She's amazing. I mean, her looks are terrific. She might have bisektomy if she wants. That's okay. The cheekbone, I said, would be much better if they are a little bit more defined slightly. We perform the procedure. We follow the patient on Instagram because this is a facial procedure, and she shares photos of her face, and we see it. It was going to be great. The photos were amazing. Months went by. I guess 6 months approximately after the surgery, she sent me a message saying, "Hey doctor, can we reduce the cheeks a bit more?" I said, "No, not now. That's because we have already removed the fat we need to remove from the cheeks. I mean, we performed the bisektomy. There's no more excess fat there. The other end of the fat tissue goes up through the templates. We tried to reach and remove the tissue. Area would collapse. I said, there's nothing more I can remove from the cheek and the result is pretty amazing. Let's leave it this way." Anyway, 1 or 2 months passed. I saw one of her photos on Instagram. The patient has fillers in her cheekbone, the corners of her chin and the tip of her chin, just because I said I can't bring it down the cheek anymore. The aim is to show the middle of the face all over as far as I can understand. Oh man, the girl turned into an alien. What a pity. When I saw her photos and I said, damn, she ruined the surgery. It's unbelievable. Why would you inflate the cheekbones, the corners of the chin and the tip to the slim cheeks down? Stop where we say, stop, there's nothing further to be done. Why are you looking for more? Well, the patient blanks down the money, and if she is a bit famous, then the doctor performs the surgery. There's always someone who does that. This girl, a few months later, shared another photo on Instagram. I'll put that photo here. I think she finally realized she has transformed into an alien. It's a little late though. I wish she realized it earlier. Such a pity. Stop when we say stop. And think about it. There's a reason when we say no. Don't wear yourself out unnecessarily, saying I'll have it done. I mean, don't force it. There's a dosage for everything, right? Even if you drink too much water, it would poison you. There's something called water poisoning. Google it. Other than that, one day I received an interesting message. A male patient. He sent me an email. He said, "Man, I want to confess about something to you." I replied him back. You can say whatever you want, but don't say it, "I'm in love with you." Because he says it's a confusion. He says, "Oh man, I got them ripped away." He says, I came to you like 6 months ago. He had many lipomas in his arms. I remember when he said that. At the time, I said, let's not remove them by local anesthesia. Let's do it under general anesthesia in the hospital. That'd be much more comfortable for you. Otherwise, we have to remove them one by one. We'll make injections for each of them, and you'll get exhausted. He said, no, doctor, we do it if you do it here. I didn't do. After a while, somewhere in a city near Istanbul, since he travels around for business, he visits some dealers. He wants to see a general surgeon. The doctor told him, let's remove them now. You see, that's also what the man wants, to have them removed right away in the next room. He says, man, they've given me so much injections on my arm and they removed them one by one. I swear I remembered you while I was screaming. He says, you were the right man. I just wanted to write you this. That's why I said, let's do it with a mild general anesthesia in the beginning. Why don't you listen to me? He was tuckered out. He said, I laid down on doctor's operating table first. When they began the injections, I simply couldn't leave. They did all of them. I was exhausted, screaming out loud all the time. Do I make myself clear? If we say something, please listen to us. Pay attention and think about it for a while. Why we say it that way? Later one day, a patient sent me another photo. He said, doctor, 3 days ago, I had a calf implant surgery. The result is this. What do you think? Man, they had the surgery and they removed the bandage on the 3rd day. A big necrosis sitting on the leg, a huge one. I mean like 10 to 20 centimeters. The tissue is dead. He says, this man is a polio case. He sent an email saying, doctor, I sent a message a year ago. Oh man, I searched and I found his email. Google keeps the mails, even the very old ones. I found his email a year before he wrote me, I have a polio, this is what my leg looks like, and it is thinner compared to my other leg. What I said when I was a middle-sized prosthesis is sufficient for you, because the calf muscle is made up of 2 pieces. I had told him only one prosthesis in the inner part is enough. He didn't show up in the city where he lives. 1 year later, he had surgery there. He had 2 large prostheses in his calf muscles. Yet, the doctor just told the patient this. He wrote this to me what the doctor told him. We hardly stuffed the prosthesis inside. That also should have warned the doctor, in my opinion. Why do you force to fit it inside if the prosthesis is too large to fit in? The body itself is warning you. I mean, if you cannot open a hole properly and place the prosthesis into it, it means there's a problem. Anyway, at the end of the day, they placed 2 huge prostheses in the patient. I mean, they placed them in both parts of the muscle. 2 huge prostheses, one for inside, the other for outside. So the blood supply to the leg is disturbed. You wrap the bandage up to the knee, you leave it closed for 3 days. On the 3rd day, when they remove the bandage, they see the necrosis. The guy takes a photo and sends it to me. I said, immediately I said, remove one of the huge prostheses. At least one of them. I mean, once the necrosis is settled, you can do the cleaning. Then there will be repairing, skin graft will be performed. I mean, unnecessarily huge prosthesis was placed in vain. A wrong procedure was performed on the guy. Certainly, this is not only caused by the illness itself. I wish he heard what we said and warned the doctors. They're saying, I consulted this person, so and so. He didn't recommend 2 prostheses like that. Had he warned them saying he said 1 middle-sized prosthesis would be enough, then maybe there wouldn't be such wrong surgery. But unfortunately, these things happen. I mean, the patients should listen to the doctor who says no. Let them pay attention to the doctor who says no, right? I mean, we experience this a lot. One day, for instance, a young man came to me and insisted I'm flap-eared. I look at him, I say, oh man, no one should say flap-eared to you. There's so little difference. Well, I said, I cannot perform this surgery on you. How could we make such fine-tuning? The boy doesn't have jack ears. No one can say that. Okay, his ear is a bit flap, but not enough to say jack-eared. I refused this boy 2 times. Then he came back with his father's one. Look, I said to the boy, how many times you visited me? Have you ever noticed my ears? One of my ears is a bit flap, to be honest. It's not a jack ear, but a bit flap. When I have portrait photo, it is obviously there. You can see it. Because we tie our back, the photo is taken from right front of me. One of my ears look a bit flap, but no one would notice in my daily life. I explained this to him. His father is saying, we are unable to convince him neither. I said, you are obsessed with it. Let it go. It's also hard to make such a fine-tuning in the surgery. In the surgery, we don't make millimetric arrangements. If it is a jack ear, we completely lay it low with sharp blow. But if there's a slight space, adjusting it, it's not an easy task. Moreover, it doesn't work neither. What difference would it make if we precisely adjust it? No one has ever noticed it before the operation and no one will notice after it. But if your ears are flap open like a sail, visit your doctor. And of course, get it done. You know what I mean? Please pay a little bit more attention to the doctor saying no. No way, don't exaggerate it and stop. What we want is the patient should come looking bad and we fix it. The result would be impressive. You know what I mean? We want to have a successful case. We want to make a difference like before and after. You know what I mean? We want to create a significant difference. The patient had a surgery and got a pretty good result, like a model girl I mentioned before. Then don't go and ruin it. Anyway, please listen to your doctor. Thank you for watching me. From time to time, I have a heart-to-heart talk like this.